Welcome and thank you for joining us. My name is Sarah Ross and I'm a geriatrician at the University of North Texas Health Science Center. My co-presenter is Jennifer Severance, a gerontologist, and we will be sharing our work in creating online content for geriatrics education of osteopathic medical students during their clinical years. Our learning objectives are outlined here, and we will share how we used the Age-Friendly Health System's 4Ms framework to structure our course content and things we did to provide clinically meaningful experiences virtually during pandemic restrictions. A year ago, the pandemic restrictions were at their peak and clinical experiences for our third and fourth year medical students were not available at all for a short time. And as they became available, they were very limited. We moved into this academic year with a lot of uncertainties about how and when we could reintegrate students into clinical clerkships. For clinical education in geriatrics, we redesigned 2 courses to continue meeting the educational needs of our students during the pandemic. These 2 courses were offered during the 2020 to 2021 academic year, and we'll provide details on the pandemic redesign and student performance and feedback during this presentation. At our institution, the clerkship directors were asked to define a minimum number of hours that a student would need with regards to contact clinical hours in order to obtain credit for the rotation. For our geriatrics rotation, we defined that as a minimum of 60 hours for the 4-week rotation, or about 15 hours per week. So within restrictions of social distancing and nursing homes being closed to trainees, we focused on maximizing the clinical opportunities that we were able to provide. For example, perhaps a student was only able to see a couple of patients in a day or be in clinic a couple of half days a week, but we had the students do more with fewer encounters such as case presentations, research of patient problems and such. Our institution also created an online self-guided study course for students to earn credit from home when in-person rotations might be unavailable to them. We created one of these online electives in geriatrics called Caring for Older Adults. For the online elective, we were asked to design the course to be very flexible, where students could work through the materials and assignments at their own pace and on their own timeline. Assessing student learning continued to be a priority, and we were interested in ensuring that the added components were effective. And we also wanted student feedback so that we could continue to improve this course. And as many of you know, this had to be done very quickly. So students were pulled from rotations in the spring, and these courses had to be ready for rollout by early summer for the next class of students. And as I mentioned, we utilized the Age-Friendly Health System's 4Ms framework to structure our course content. And I want to provide a brief overview of this framework. The 4Ms are seen here: what matters, medication, mentation, and mobility. And these are areas that are important for the care of older adults and represent things that could potentially present problems in the care of older adults. When a healthcare institution, be it a clinic or a hospital, is working towards obtaining the Age-Friendly Health Systems designation, what they do is create a plan to assess and act upon each of the 4Ms for each older adult patient. And hopefully these things are already happening in some health systems, such as screening for depression, but the 4Ms framework provides an opportunity to assess what's being done and identify the gaps in care to improve the quality of care for older adults across the healthcare system. Age-Friendly Health Systems was brought about by the John A. Hartford Foundation and the Institute for Healthcare Improvement. And there are several web addresses there for resources for more information about age-friendly health systems and the 4Ms framework. So the first course we will discuss is the Geriatrics Clinical Clerkship. Prior to the pandemic, this was a typical rotation that depended on exposure to patient cases in a variety of settings where we care for older adults. 4 weeks long, also included an assignment on interprofessional care of the geriatric patient, as well as a hands-on OMM didactic session that was held in person prior. So here we have the pandemic redesign of the rotation. We created a hybrid experience where there was both in-person and in-person clinical activity and online self-guided study content. And the students who were with us were primarily in clinic, though we were able to provide other experiences such as house calls. We, in the past, have had students with us in the nursing homes anytime that we're there. And so that was a big challenge. And we shifted to providing some telehealth or teleeducation experiences with virtual nursing home rounds where we set up a secure Zoom meeting and took the students with us to see nursing home patients. So the rotation continued to be 4 weeks and some of the content was modified to create some additional didactic sessions and assignments that the students would do asynchronously, including some content on OMT. Here's the breakdown of how a student on the rotation would spend their time in any given week between in-person clinical activities and self-guided study activities. The 4Ms framework lends itself very well to a 4-week-long course, and the content for the self-guided study each week was dedicated to one of the 4Ms. For example, during the week dedicated to mentation, the online learning module was on the topic of dementia. The aquifer cases centered around dementia, depression, and delirium. And the AGS slide sets that were chosen were also related to those topics, dementia, depression, delirium, and other things that can affect mentation, such as neurological disorders and sleep. So each section contained additional study resources related to that M for that week, that focus area. And then each week also included a didactic content connected to an assignment for the students. This slide provides a list of the types of clinical experiences that our students were able to participate in. The first 3 are telehealth experiences and the remainder are in-person experiences. As you can see, the bulk was outpatient office setting, including telehealth encounters in the outpatient setting. But we were also able to provide a lot of students with the experience of doing a house call and some assisted living. Very few nursing facility or other experiences due to many of the restrictions secondary to the pandemic. This is a summary of our feedback for this hybrid clinical and online content geriatrics rotation. And overall, the students provided positive feedback and felt that the online content was helpful. The responses are on a Likert scale from 1 being terrible and 5 being excellent. And so overall, the responses were very positive to the course. We also were able to assess students' pre and post competencies with respect to their confidence in these various areas that you'll see listed here. So for example, the geriatric H&P, the question is, I am able to perform a thorough history and physical on a geriatric patient, taking into consideration possible cognitive, functional, and sensory impairments. And they would rate that 1 being 0 ability, 2 being slight ability, 3 being moderate ability, 4 significant ability, and 5 complete ability. And all of the areas showed improvements after completing this rotation. The next slide here is some information on the disciplines that the students were able to interact with for their interprofessional practice assignment. So this assignment has been in place for the geriatrics rotation for the last 3 years. And I do have data for the last 3 academic years presented here. The assignment basically involves the student presenting a patient case where another professional was involved in that patient case and reflecting on what that other professional contributed to the encounter, the reason that other professional was involved, the value that they added, and how the plan might have changed because that other professional was involved. The bulk of the students interacted with social workers, and we do have several social services team members in our clinic, so that was not surprising. We also have some psychiatry and psychology services in our clinic, so this year that was a high level of students that interacted with those professionals as well. Fewer that participated in a collaborative patient case with a physical therapist, and that's directly related to the fact that they were not in the nursing homes, I think. So in the nursing facility, the PT, OT, and ST and dietetics professionals are very much integrated into those long-term care nursing home teams and less present face-to-face in our clinic. So it was interesting to see how that distribution shifted a little bit with the changes that occurred in the rotation due to pandemic restrictions. I wanted to share a few quotes from students from the interprofessional practice assignment, just to demonstrate some of the things that the students were able to learn and recognize. So this assignment helped students to recognize the value of teamwork and communication, as well as to learn about the roles and responsibilities of other disciplines. So the first student says, I've learned during my clinical rotations that each individual is vital to a practice succeeding. Medicine is not a one-man job. Medical students, medical assistants, nurses, social workers, pharmacists, nurse practitioners, physician's assistants, and physicians all need to participate to make things run smoothly. The second student says, I thought this assignment was a great way to learn about the role of different members in patient care. I had a general idea of the role of a social worker, but I was surprised by the different services they are able to get to help patients. And the third student says, I'm thankful this assignment forced me to directly communicate with different team members. The next assignment I wanted to highlight is the psychology of loss, and this was a new assignment for this academic year. There was a didactic session where one of our social workers presented content on how individuals might experience different types of loss across the lifespan. And the assignment that accompanied the didactic was a guided interview with an older adult where the student and senior discussed the transitions and losses the older adult had experienced across their lifespan and how they have adapted. So here we have the demographics of the older adults that were interviewed for that assignment. And on the next slide, we have some quotes from the psychology of loss assignments and some of the things that the students were able to learn here. So they discussed things that had occurred to these individuals that they had to navigate to demonstrate either successful or challenges with age-related losses. So one of the seniors that was interviewed was an 83-year-old, and the student reports that she has navigated the advanced age stage of life successfully. She lives with her husband in a senior living facility and is still able to get out on walks and enjoy certain things by the lake. She's come to terms with things that she can no longer do, but enjoys the things she can. And an 84-year-old that our students interviewed says, I think the biggest thing I learned from her is to always be honest with yourself and not be afraid of what you have no ability to change. Life will happen no matter what you plan, and it's the ability to bend that will strengthen a person's mental health. She stressed the importance of being at peace with yourself, even in the face of hardship, because there is no sense in being sad when there is so much to be happy about. and an interesting situation with another interviewee that was a 67-year-old gentleman. The student says that his mood appears to be mostly frustrated. I feel he also has a loss of identity, which is going on from an independent adult, going from being an independent adult who does not have to look after anyone to transitioning to a caretaker within a year. He now cares for his mother-in-law and daughter, taking away some of his own freedom to do what he wants and make his own decisions without considering the needs of others. With the pandemic, he feels even more at a loss of control over his life and situation. So just wanted to share some of those things. Again, we tried to provide assignments that would have our students connect with people during some of these pandemic restrictions. And so these opportunities to interview other professionals in the field and to interview seniors and older adults, I think were valuable to provide them some insight into some of the things that are important to geriatrics and the care of older adults. I'll now turn things over to my co-presenter, Jennifer Severance, to talk about the second course.
Thank you, Dr. Ross. So we'll now turn to an elective course entitled Caring for Older Adults. This course was originally offered as an honors elective over 6 one-hour sessions during a semester. And the objectives of this course were to introduce students to the continuum of healthcare and long-term care services and supports, which would prepare them for care of older adults and also equip them during their clinical rotations at different sites of care. Students from medical, physician assistant, and physical therapy disciplines participated, and we also involved faculty from different disciplines, including healthcare administration. The major assignments in this course included journal entries and geriatric case presentations. At the start of the pandemic, this course was adapted to be totally online and self-directed to provide maximum flexibility for the 3rd and 4th year medical students who participated. The course also changed from 0.5 credit hours to 4 credit hours. This required a major course redesign and additional content development. And like the geriatric rotation, the content was divided into 4 weeks, with each week dedicated to one of the 4 M's of age-friendly health systems. We researched content that could engage students through different modalities, such as articles, videos, and podcasts, and we also added quizzes to assess content knowledge. Instead of a requirement to do both the journal entry and case presentations, students can now select from one of these assignments. We wanted to provide an opportunity in this course as well for students to have direct interactions with older adults. So we added an assignment called the Patient's Health System Experience Interview. In this assignment, students explored the health system through an older adult or family caregiver's experiences. This slide presents a breakdown of the course components and the estimated hours per week for completing course materials and assignments. The bulk of the time is spent on self-paced learning through journal articles, videos, and other content to develop knowledge about geriatric topics, best practice tools for assessments, and community resources for patients. We also incorporate examples of healthcare systems that change their internal processes to implement these best practice tools and improve care for their older patients. Students completed weekly quizzes, and in addition to the assignments and optional resources and materials, students end up spending about 40 total hours per week on this elective. As of this recording, 73 students have enrolled in this course in this academic year. Students complete surveys at the end of the course to assess their knowledge and skills and to rate the course materials and content. And they use a 5-point Likert type scale, from 1 being strongly disagree to 5 being strongly agree. And as seen in this table, scores show that on average, students agree that the course improved their knowledge about geriatrics care and settings for care for older adults and about the 4 M's of age-friendly health systems. Also, in general, students agreed that the course components were helpful to their learning and was useful to their future practice. Although not included in this slide, student responses to open-ended survey questions showed that they had a preference for the dynamic and interactive elements like video content, case studies, and the guided interviews with older adults. As Dr. Ross had mentioned, it was important that through these courses, we continue to maximize opportunities for students to have patient interactions and develop their empathy and communication skills with older adults and family caregivers. So as I had said, the students completed interviews with older adults and caregivers called the Patient Experience Assignment, and they could reflect on perceptions about an experience that an older adult or caregiver had in a specific healthcare setting. So we identified themes from the student assignments that demonstrate what they learned about the patient experience. The first theme was about patient and provider communication. In this first quote, the student interviewed an 84-year-old non-English speaking patient who had immigrated from Jordan. And they talked about her recent inpatient stay. And the student commented that all of the tools and the resources we have at our fingertips are meaningless if we don't partner with our patients to ensure they are receiving the care they want and deserve. In the second quote, students frequently identified environmental aspects that contribute to the patient experience. For this quote from a caregiver who brought her father to a primary care clinic, the biggest factor that affected their experience was accessibility for her dad, who had limited mobility. Having the ability to park close to the entrance, to the doors and entrances to rooms within the facility, especially the restroom, can limit her dad's ability to function independently in the clinic space. And then in the interview, students also learned about unique challenges older adults experienced during the pandemic. In this third quote, an 86-year-old caregiver shared about losing her husband of 72 years during the pandemic. She had a hospital visit after a fall during COVID, and she shared that because of COVID, her daughter was not able to be in the room for much of the explanation. And although she explained it to her daughter afterwards, she did not know if she remembered everything. Students were also able to apply the 4M's framework to interpret the older adult's experience. In this first quote, the student reflected that as a result of the interview, another takeaway they had was that they will always strive to communicate at the level of their patient, which begins with assessing their mentation and understanding their medical condition and care. And finally, interviews brought to light experiences that older adults have across a range of care settings. In this first quote, when reflecting on in-home hospice care, a student remarked that her experience emphasizes the importance of each member of the healthcare team working together. It highlights how useful it is for doctors to know multiple resources to refer patients to end-of-life care. And finally, another student observed the difficulties of navigating complex systems of care, commenting that the older adult can get confused on what she needs to do after the ER visit and what the assisted living facility will take care of after the visit. The older adult also stated that some of the technology they use to follow up with her can be hard for her to understand. So these quotes show that this type of structured interview has the potential to help students develop empathy and skills essential to patient-centered care for diverse older adults and caregivers. We were also interested in knowing how the medical students who completed these elective courses may be able to apply geriatrics care in their future practice. We pulled data from Match Day about the specialty of the fourth-year medical students that they will pursue in their residency placement. These are the results for the students that completed each of our courses. The majority of students who completed either course matched into 4 major subspecialties: family medicine, internal medicine, psychiatry, and emergency medicine. With a shortage of geriatricians, family medicine and internal medicine physicians will care for the majority of older patients. And for students pursuing psychiatry and emergency medicine, their added coursework in the geriatrics care can equip them to assess and address the unique needs of their older patients. Other specialties that students matched in were neurology, physical medicine and rehabilitation, gynecology, and other. And from this data, we may conclude that students going into these specialties value opportunities to improve their knowledge and skills in geriatrics. And also, these students going into primary care may perceive that added clinical training in geriatrics is important to their preparation. In conclusion, students reported the online and hybrid courses met their educational needs during the pandemic. And they also reported that the information was applicable to their future practice. This project also shows that geriatrics clinical training is an important component of undergraduate medical education that seeks to prepare a primary care workforce for the growing number of older adults. There are other lessons to note as we look back on these pandemic adaptations to these educational courses. First, online courses should maximize opportunities to incorporate dynamic interactive content that can connect students to real people and experiences. And students had a preference for this. Also, these kinds of experiences can produce unexpected benefits, such as new insights about older adults from different social, racial, and ethnic backgrounds. And even though we wanted to provide students flexibility through self-study, students still needed structure that made them accountable for course timelines and assignment due dates. And finally, as we think about the future delivery of the course, we see opportunities to improve how we integrate the 4 M's of age-friendly care into the assignments. We see ways that we can improve the representation of diversity of individuals used in examples and case studies. And we want to ensure that if remaining online, the course meets ADA requirements. So we're in the process of determining the future of these courses, whether they'll be online, in person, or a combination. The geriatrics electives may remain available as a self-study option for students, particularly during interview season. And if the courses will remain online, whether hybrid or 100% online, there are several institutional requirements to overcome for online coursework. Whichever path unfolds for these courses, we know the age-friendly 4 M's provided an effective framework to continue clinical geriatrics training through virtual delivery, and we hope these examples can be useful to others considering course adaptations. We want to acknowledge our collaborators in the course development and delivery for their support and collaboration. Please contact us with your questions and comments. This concludes our presentation, and we thank you for your time and attention.